Welcome to Talkin Maine with Tom Saviello, and I just realized I forgot to put my bow tie on, but I got it in my pocket, and I can put it on later if you want me to. So I have a special guest today, our new orthopedic surgeon, I can't even say it this morning, surgeon from Franklin Memorial.
Hello, sir.
Doctor, and who are you?
MT Newman.
MT Newman. What's the MT stand for?
So my parents were movie buffs, and you've heard of Elizabeth Taylor.
Yes.
And so I would, my sister's not named Elizabeth Taylor, but I guess her fourth or fifth husband was named Michael Todd.
Oh, yes.
Yeah, he's a director.
Did you get married him twice?
I think so.
I think so, yeah.
And so my parents they couldn't decide Michael or Todd, or I think Jared was in there too. But they hyphenated it. They said, all right, Michael Todd. So that's my first name. And a lot of Kentuckians have first name like John Boy. Remember that? From
Yeah.
So shorten it to MT.
Where in Kentucky?
Lexington.
Lexington.
Horse country.
Oh, it's too bad. I went to the University of Tennessee.
Oh, did you?
Yeah.
We don't recognize Tennessee.
We don't recognize Kentucky. Although
it's
we
a Mason-Dixon line.
We did beat you in football this year.
You did. That's a sore subject. Yeah.
You kind of had the ball.
We had a great year.
Yeah, you had a great year. You had the ball like 100 minutes, and we had it 5.
Yeah, I noticed that. And then the Georgia game wasn't very good for us either.
Georgia's unbelievable.
Yeah.
So welcome.
Thank you.
So how did you get started, and where did you come from? You and I shared a little bit before. But
Yeah. So I guess the whole story was I grew up in Lexington, Kentucky, the son of 2 cops. So you know who they say the 2 worst people are, priests or cops. So I muddled through there. Ended up going to University of Colorado for my undergrad, and then immediately back to University of Kentucky for med school. I had to find a way to pay for it, so I joined the Navy at that time. So once I was done with that, the Navy said, well, we're going to make you a general surgeon. So they sent me to Chicago to train for a year, but then midway through that year, I decided I didn't want to be a general surgeon. So they sent me to flight school in Pensacola. Yep. So I got to go to flight school in Pensacola for almost a year. And this is long-winded, by the way.
That's good. That's all right. It's fascinating.
So they sent me to Pensacola for a year where I flew T-34s. Now they're the T-2 Texans, so they're a little bit different. They have the new glass cockpit. This is own single prop plane. And we flew helicopters, and they made me what's called a flight surgeon. So it sounded really sexy, but in reality, I just took care of, I was a doctor. I was a primary care doctor. So my first assignment, they were going to send me to Jacksonville, Florida, and as I'm driving to Jacksonville, they called me and said, nope, you're going to Beaufort, South Carolina to be with the Marines. That didn't turn out to be the case either. I was with a F-18 squadron of Navy folks that had just moved to Beaufort. So I was in Beaufort as a flight surgeon flying F-18s for about 4 years. And on September 11th, I was sitting in my house eating a bowl of Frosted Flakes, maybe? And with my flight suit tied around my waist, getting ready to fly that day, and it said that the planes crashed in the tower. And immediately we were on alert. They called us in, closed down the base. A couple of our pilots went out and did sorties, kind of flew around just checking out. And a week later, we left on the Theodore Roosevelt.
Really?
We were spun up, said, let's go. We took what's called a carrier air wing with 8 squadrons of planes and a squadron of helicopters, and we went immediately over to Persian Gulf. I remember it was probably mid-October. We weren't really doing anything. Went through the Suez Canal. We were supposed to have a European cruise tour where we stopped everywhere and just got off and had liberty and had a good time. But we didn't stop we didn't stop at all for almost 8 months. So we went to the Persian Gulf. I remember we got called into the ready room. Oh, it had to be probably midnight there. And all of a sudden in the ready room, they had this closed circuit secret TV and Dick Cheney.
Really?
Dick Cheney said, we're going to begin operations in about 6 hours, Operation Enduring Freedom. And our pilots took off. I was the doctor on board. There were 5 doctors on board.
That was in October, right?
That was in mid-October, as I recall,
yeah.
We were actually the first carrier to do flight operations. We stayed out there till, April. Didn't make a single port call until on the way back. We stopped in Marseille, France, and I don't remember any of that. But made it back home in April, and then after that, went to Bethesda Naval Hospital to train as an orthopedic surgeon. Was there for 4 years. And then I wanted to do some specialized training, but the Navy always makes you do what's called a utilization tour, which means you go do general stuff in orthopedics for 2 years. And I didn't really want to go, but they sent me to Italy for 2 years.
Oh,
I know. So I worked for NATO out there for 2 years. Came back to the University of Pennsylvania to specialize in joint replacement, hips, knees. Did that for a year, and then moved back to become the head of joint replacement at Walter Reed,
Wow.
where I was there for about 5 years. before deciding that we wanted to get off the grid after moving so much. My wife and I moved up to Maine 7 years ago with our 2 kids. I was working in Lewiston for about almost 7 years and made a change and started up here about 3 weeks ago.
Well, welcome to the neighborhood.
Yeah, it's been fun, yeah.
So far it's been fun.
Yeah, so far.
That's quite an experience,
Yeah.
driving all around. Now, when you were in flight school, did you actually fly?
Yeah,
Flight
so
surgery?
we did. It was variable. Some people took it really seriously and some people didn't. So the more you studied, the more you were prepared. You got to do everything. I would say I was middle of the road. I was, it's like drinking from a fire hose when you're going through flight school. It's a pretty intense. Like I don't think we appreciate as much as the military pilots do. So yeah, I actually was in control of the aircraft quite a bit. Yeah, only threw up once. Yeah.
Only once?
Yeah.
Oh, that must not. Well,
Yeah.
I can't imagine. I mean, just seeing the guys when they're turning like they are and stuff like that, I can't imagine where your stomach
Yeah, the one that was the hardest was the aircraft carrier takeoffs.
That really?
Yeah. I didn't fly as much off the aircraft carriers because of the situation we were in, but probably a couple dozen times, and that'll get you right in the gut.
Is that now they catapult you off?
They catapult you off.
So you're really
yeah.
moving fast.
So F-14s, S-3s, and C-2s is what I flew off on.
I think I'd be more nervous about landing on the airplane.
Well, I was just doing the crossword puzzle in the back, so
Jesus.
it was a little more. Fortunately, I was not in control of the aircraft when that happened. Yeah.
Well, because you got to hook you to catch it.
You got to hook it. Yeah, that's
if you
right.
miss the
That's
hook,
right.
you're
You got
dead
4
too.
hooks. You don't like to catch the last one because that means you were close to not catching them at all.
Oh, Jesus.
Yeah.
So your specialty as you come to now, are you the head of the orthopedic group here at Farmington?
Well, I'm the only guy right
the
now.
only guy.
So historically, there have been various orthopedic surgeons here, and there was a private gentleman who has served the community for quite some time, almost 30 years, Joe Caldwell.
Right.
Joe just retired, fortunately, and he's doing what I'm doing, or he's doing what I'd like to do, is move down to Key West for at least part of the year. So I heard rumors that he's moving down to Key West. So that left a real void in Franklin County and Farmington and Wilton, Jay, Livermore, of an orthopedic surgeon, and that opened up the possibility. We're hoping to grow it. It's very exciting. We've got a lot of opportunity. Right now, I'm alone and unafraid, as they say.
Alone and unafraid.
That's right.
So are you up here? You didn't move up here, though. You still live in
No, my wife works at Maine Medical Center, so we medical professionals in the state of Maine. So when we were at Walter Reed, I had the close drive, and she worked at Johns Hopkins. So we flipped it this time. So what I'm doing now is I'm driving up on Monday mornings and I'm leaving Thursdays. So I have a nice weekend along with the kids. The kids are ensconced in Catholic school down south in Portland, so she really didn't want to uproot them if we didn't have to. So this is going to work out, I think, very well.
Oh, it's good.
Yeah.
Of course, we'd always welcome you if you want to move up to Wilton.
Yeah, well, we're sugarloafers, and I am looking for a property to buy up here. So anybody have anything?
Yeah, well, good luck.
Yeah,
Because every time I look at a piece of property, it sells for about 10 times what it's
exactly.
worth.
Yeah, it's been frustrating a little bit, but there's stuff out there.
Because we've been looking for a camp. I have 2 older kids. My daughter's in North Carolina. My son's South Portland.
Okay.
And so they all of a sudden say, hey, we want a camp, Dad. Okay, so I started looking. Well, I should have bought one a year and a half ago. I've been great. Because everyone I look at, if you have one you want to sell, just send me out there to look at it because I guarantee it'll sell the next day to somebody else.
Good call. Yeah.
So your specialty is joints.
Yeah.
So it's knees and hips.
Yeah.
What about shoulders?
I don't do shoulders. We're looking. We do have resources to bear with Maine Health, so we're a part of Maine Health, which covers 60 to 70% of the lives in Maine. So we have great resources with that. We're trying to build a program that's both sustainable and also offers the same service you'd have in Portland. At a much more closer facility, maybe a little more personal touch. I know a lot of patients, at least where I was from in Kentucky, no one liked to go to Lexington to get their surgery. They want to have it near their home where they know people and where they have a support system. And so that's what we're trying to build here. The same services, the same quality, but in a location that you're comfortable with.
Is Greg Sawyer in your program?
Greg Sawyer's there. Yeah, he's great.
He's a
That's who you got to
Wilton
see.
guy.
Oh, is he? Is he a Wilton guy? I didn't know. I know.
Wilton.
I think my wife knows Greg
Yeah,
through Wives
yeah.
Club, and I think I've met him once or twice. But he's fantastic.
He's a Wilton
I've heard.
boy.
Yeah,
He's
is
a
that
Wilton
right?
boy.
Great.
Yeah, he
great.
played basketball here and then went to Colby, I believe.
Okay.
I don't remember where to medical school, but I do know
he's a big guy.
He's been down in Portland.
Great.
So he's got good roots. See.
Yeah. Great roots.
So, with a knee replacement, are you also doing the other things like broken bones?
Yeah. I do a lot of general stuff. We do broken bones, fixed a broken shin bone the other day. He fixed the hip the other day. Yeah, I fix major bones. Some of the smaller bones, we always have this joke in orthopedics: if you can swallow the bone, I don't operate on it. So that's what we call our hand surgeons. But we're trying to recruit some hand surgeons up here too. So yeah, I fixed broken bones.
See, I would have
as
been
well.
a prime candidate for you. I broke this elbow twice, this one once.
Is that
this
right?
wrist once, and this wrist
I'll
once.
give you my card before I
You
leave.
know, I did that last one when I was 36. I'm suffering from it today because I got arthritis in
That's
both
right.
wrists so bad.
That's right.
It's not bad, but
That's right.
it's there. It flares up.
Yeah.
I broke my nose.
I can't fix that.
I can't
yeah.
fix it. No,
Yeah.
no, that's good. I don't want.
That's
I don't
good,
want,
though.
They kind of got it back in the right place. There's a
Yeah.
hole in the side where I got hit with an elbow in a wrestling match.
Is that right?
Yeah,
Okay.
So, it's all right. So injuries that you do see. I mean,
Yeah.
we're coming up. My always understanding is that Franklin Memorial did really well around ski season.
Yeah. Yeah, that's what I'm kind of curious to see what will happen. I've certainly been up to, I'm at Sugarloaf every vacation week, every weekend, and I certainly hear of injuries and injuries and injuries. I think a long-term goal would be able to have some resources up there. That's maybe a long-term strategic goal. I think it's, growing up in Colorado and, skiing at some of the big mountains, you usually have resources there if you get acutely injured. If you have a cold, if you're there for a vacation and you need just some medical care. But yeah, I'm curious to see. There's quite a bit of extremity injuries. Obviously, hopefully we'll be able to take care of most of it at Farmington. But there may be some injuries that we can't take care of. But,
So with the knee, they've changed the technology. At least
Yeah.
I literally still have all of my parts.
Yeah.
I haven't traded them in for
Okay.
something long lived. So they've gone. Are they plastic knees now? Titanium knees?
Yeah, that's a great question. Most of the hips have mainly titanium, and the knees are a bit more cobalt chromium with some trace metals in it, nickel, cadmium, or vanadium, and polyethylene. So what we do essentially is we just cut off the ends of the bones and we recap it with metal and plastic. It's, I'm kind of like a carpenter, only things bleed, and they don't bleed in carpentry unless you hit your thumb.
Well, no, they do if you hit your thumb.
Yeah, that's right, that's right. Yeah, so my wife, when I was in medical school, I thought I wanted to be, ER was on, and I wanted to be George Clooney, right? And so
Kind of look like them.
I doubt that. I wanted to be a trauma surgeon. I just wanted to be in there to save lives. Well, as I got through it, trauma surgeon hours kind of stink. You're up at all hours of the night taking care of things. So I kind of thought to myself, well, what can I do surgical-wise where I can, do some really meaningful things? And my wife still wishes I was George Clooney, and I'm not, and she doesn't think that's sexy. And I said, well, here's what I do. People who are devastated and don't have their lifestyle, I get to change their life back. I get to give them their life back. They don't like that they can't ski, they can't hike, they can't snowmobile, they can't fish because their joint hurts so bad. And so it's just so rewarding to be able to replace somebody's joint and objectively see their progress and see that they're able to. I have this old joke where when I'm talking to people about surgery, I was like, listen, you're going to hate my guts and wish you never met me for a few days after the surgery. But by 3 months, you'll be baking me cookies and put me on the Christmas card list. I was here one day and got cookies from one of my patients.
Really?
I was here one day and got cookies.
Because the pain
Because
was so,
it was so bad, and she was doing so well. Went to Florida for the winter, and she's doing great.
So I picture when you're going to, if you're sawing my bones off,
Yeah.
you got to make a pretty big incision, but not anymore.
Not anymore. So there's a couple of different ways to do it. The minimally invasive surgery has been a catchphrase in orthopedics for a while. What it really means is making a smaller incision so you do less damage to the soft tissues, because that's really where the pain comes from. So I always say we make an incision small enough to do the surgery, but big enough to see what we're doing. There are computer models and robots that we're using now, but I always tell people, do you need a robot? It's like, well, I have a GPS in my car, but I know how to get home, so I don't need the GPS. Same thing with a robot. I think at last count, I've done almost 4,000 joint replacements.
Wow.
So I feel like I know what I'm doing, and just you kind of get a sense of how you're doing it when you're doing it. But yeah, the recovery process has gotten easier. We're using newer medications. Most patients are actually going home the same day now.
Really?
Yeah.
Same day?
Same day.
Wow.
Yeah.
I mean, I've had friends that do it, but they've been in the hospital a couple days, and then when they're home, they're in the ice pack, and
That's right.
they're tied up for weeks.
Yeah.
What about shoulders? Not replacement, but shoulder like rotator cuff. Are you doing those too?
Yeah, well, we have a partner from Maine Med named Link Avery who comes up a couple times a month and is doing shoulder surgeries, reconstruction surgery for ligament injuries like anterior cruciate ligament injuries, and he's fantastic. He's been in Maine for many, many years. And we're trying to get more full-time coverage for that. Yeah, but we cover those as well. Rotator cuff tears and biceps tendon tears, stuff like that.
And am I right? The shoulder is a tough place to heal.
It's a tough, usually if I kind of rank what I feel is the toughest to get over, I think the hips are easiest to get over, followed maybe by the knees. The shoulders are probably third. They're pretty tough. It's one of those things where most people have to sleep in a chair for a while afterwards, in a recliner, and it can be pretty tough. Again, newer technologies and more different pain protocols, and people are actually doing pretty well now. But it's tough. Any surgery is tough.
Yeah. Well, my shoulders are sore, but I don't want to get them out.
Okay. All right.
I'm going to live as long as I possibly can until they go boing, and then it's like, oh, shit. I gotta come visit you guys. So, at Franklin Memorial, you've got your office now.
Yep.
And we forgot, did they get your phone number? If somebody needed to call, they can just call.
Yeah, it's a 121 number. I can 674-84.
So we'll find the Franklin
Yeah.
Memorial Hospital that's
Yeah.
in there. And I assume that, now you talked about golf. What kind of injuries do you get for golf? Other than wrapping your club around your head.
Injuries from golf usually entail probably drinking too much and then falling out of the cart. Not too many chronic overuse injuries sometimes with golf with respect to knees and wrists. Not a lot of operative stuff there, but certainly people that get elbow, wrist, shoulder pains and stuff like that. I have not yet injured myself from golf, but I've hit a couple people with golf balls.
I've come close.
Yeah.
I've hit them, come closer with my golf club.
Oh, yeah, I try to, you got to clear
Somehow it slipped
that.
out of my hands.
Yeah.
I can't understand why. So tell us how you talked a little bit about it, but how you want to grow Franklin Memorial.
So if you look at where things are heading in medicine, it's changing rapidly. COVID has not helped. There's a ton of burnout in medicine right now, which is kind of a different topic that we could touch on. But it's getting harder to make money, and it's a verboten term that you got to make money to do the mission. So there has to be some type of incentive there where we can make money to keep things running. And so what we're seeing a lot of these procedures. Bigger hospitals are getting bigger, and there's people are looking at these big hospitals and they're like, I'm going there for my cardiac care, I'm going there for my orthopedic care, and so it's really siphoning off the patients from the smaller hospitals. Not only that, I think Maine struggles a bit from the insurance game. When we talk about payer mix, certainly private payers where you're employed certainly pay better than Medicare, Medicaid, although we service everybody at Farmington. But when a good hospital profit margin can be as little as 0.4 or 0.5%. So when you're working with that little of a profit margin, you need to try to maintain all the good payers in town. So again, with that mantra in mind, we're trying to create a program that's sustainable, reproducible, so we could take this program and institute it at another hospital, maybe another rural hospital in Western Maine. And that's a challenge. We're going to need 6 months to kind of figure out the lay of the land. It may be that we, have a lot of surgeons that are out that live kind of in southern Maine, but then they move out to they go to North Conway, they go to Mid-Coast, they go to Farmington, some of the northern hospitals. So that's what we're trying to grow there. We're trying to get an entire service line. So orthopedics has 7 different subspecialties with hand, pediatrics, shoulder, or sports medicine, foot and ankle, spine, and joint replacement. So we're not sure we're going to have the full service line, but certainly the service line that would catch 95% of what we do in Farmington.
Wow, that's pretty exciting.
Yeah, we're excited.
So right now it's just you.
It's just me. It's just me. I'm trying, drinking from a fire hose, as they say.
Wow.
Yeah.
Wow. So have you got a lot of patients now that you've already started to take care of?
Yeah, so I've already done the first week I was there, I did 2 surgeries. I've already booked almost 20 joint replacements.
Wow.
For hopefully get them all done in December. I was doing probably close to 400 when I was at St. Mary's a year. That's a little bit less than I'd like to do, but I think up here it's going to start slowly. So we have some good goals, some realistic goals for this first couple of years.
Now, how about the technology on broken bones?
Yeah.
I mean, that's changed dramatically too, because when I broke my elbows, I ended up with a plaster cast that was up to here, or taller for my elbows. And my wrists were certainly up to there. How do you make the decision between an operation on say a broken wrist versus just setting it the way it is?
Yeah, so there's clinical indications, right? So people smarter than me, and we all kind of stand on the shoulders of giants in whatever we do now. And so smarter people than me figured out that if you look at a bone and it's this crooked, it'll do fine. But if it's this crooked or if it involves this, then it's operative. So we use those clinical indications or surgical indications, we call them, to determine whether or not we fix them. Now, certain fractures or broken bones by definition just need to be fixed, like hips, usually shin bones and femur bones. But the technology is amazing. I wish at some point, there's always YouTube out there. People can look at it. But most people don't go down that rabbit hole necessarily. So I did a surgery the other day without naming any names. Lady broke her hip, and I put a long rod down her leg, all the way down her leg, probably that long, with a screw up into her hip and with incisions that big.
Really?
The technology is amazing. So again, going back to the mantra of the less incision, less soft tissue damage you do, the quicker they can recover. Did fix the shin bone, put a rod that long in a young gentleman's leg the other day. Incision was that big right here.
Really?
It was amazing.
So you can go in, you can actually see into it, or you?
Yeah, I have a live X-ray in the operative room.
Live X-ray. Okay.
The industry, the industry is a lot of smart doctors, a lot of smart engineers works with the industry. Some of the people that sell us the instruments, and they've come up with amazing technologies that then we learn and incorporate in our practice.
Wow.
So yeah.
I mean, because in the past that would be a major, and then does that reduce the amount of time they're in a cast?
Yeah,
and they go right to rehabilitation right away.
That's right. So the main focus of most orthopedic surgery is early return to function. So the lady whose hip I fixed, she got up that day.
Really?
The gentleman that we did the tibia on, he can walk on it today.
Really?
Yeah, that's why we do it. We fix bones so you can early recover. Because back in the day,
6 weeks, 8 weeks.
Yeah, you're in traction and you're in the hospital and the bills are astronomical. So we're trying to do a lot of the trauma surgery and broken bones on what we call outpatient basis. So yeah.
Holy mackerel.
Yeah,
I
yeah.
mean, I just think back to when I was in the hospital. I can remember I was about 6 years old, but what I can recall is one elbow I was in the hospital for like 3 days.
Yeah.
I didn't get put in traction, but I was in multiple casts. So they put it on, the arm would swell up.
Yep.
Then they would, when the arm would stop swelling, they would take off the cast, put another one on.
Yeah.
And then I can remember the very last wrist I broke, they finally had light casts, the fiberglass
Yeah,
casts.
that's right.
And then I was able to get to that, which was like, oh, this is a world of difference.
Yeah, we're starting to look into the technology of 3D printing casts. So you put your arm in the cast and it makes your cast as you put it in there. The technology is out there. It's quite expensive right now, but it's exciting. Isn't that crazy? Yeah.
Jeez.
Yeah.
So of all the things you do, you say you like to do knees the best, or?
Yeah, I feel like I get the most reward for knees. I feel like technically it just makes sense to me. I've probably done the majority of knees. That's typically how it goes. Most people suffer from knee arthritis. More people suffer from knee arthritis than they do hip arthritis. And so it's probably 70-30 knees to hips. Knees are tougher to get over. There's certainly different things that can happen. People, there's probably a good handful of people that just aren't satisfied with what they get. But that's part of my job to teach them what the expectations are.
And now how about torn around my knee, tearing it up, the ACL and so forth? Has the recovery rates changed on that, and the way you operate on that changed?
Yeah, quick recovery. Many incisions. Dr. Avery, who I spoke about earlier, can reconstruct your ACL in incisions about 3 incisions about this big, and the recovery is still the same. It's actually, there's this old adage that it's better to break a bone than it is to tear a ligament, because ligaments tend to take a little bit longer to heal. So, but the recovery process is still quite prolonged. You'll probably see football players that progress a little bit quicker because they have 20 people fawning over them trying to get back to the football field. Like Adrian Peterson's a good example, who used to play for Minnesota, who got back from an ACL injury after like 4 months, which is superhuman. Most people, it still takes a while after ACLs. After knee replacement, it's actually a quicker recovery sometimes than ligament surgery.
And I remember the broken bone thing is that when your ankle, if you break your ankle, it's a better, quicker recovery than if you sprain it. What's the difference between a high ankle sprain and a regular ankle?
Most people, when they're talking about a high ankle sprain, so the two bones between are connected by what we call a syndesmosis, and it's a ligament that connects the two bones together. So I think most laymen, when they're talking about high ankle sprains, it's the separation of what we call the syndesmosis, or that ligament that they're talking about. And that's kind of the high ankle sprain that they worry about.
So that's in the tibia?
That's between the tibia and the fibula, the small bone on the outside of the
ankle.
So
that comes, now, sorry, knock my thing out.
Yeah, I know, right? It's beautiful.
It's the first time you're ever on my show, and you're the only one who's ever done that. So it's, now I understand. So that's between here.
Yeah, that's a tough injury to get over. Oftentimes you have to operate on that if there's some separation there.
To try to bring it back, draw it back
together. Try to bring it back together so the mechanics of the ankle work correctly. Because if the mechanics of knees, ankles, or shoulders don't work together, you tend to, I kind of use the cheese grater technique, the way God or whatever religion you choose made us, we work in symbiosis with the other knee joint and other parts. And when you have any mechanical changes from what you were born with, you start kind of cheese grating and you shift a little bit. And if you start cheese grating your cartilage, then you end up with post-traumatic arthritis and all the bad stuff.
Or you start limping and your back starts to go.
You start listing to the, as the Navy term, listing to the right.
Left and right, and it starts to make a difference.
That's right.
So what message would you have to those people that are out here that are watching the show?
So full service line so one of the things that I enjoy most about orthopedics is getting to know people. I always try to get a connection with someone immediately. Find out where they're from. Do they like fishing? Do they like skiing? Let's talk about something, because when you come in, oftentimes you're obviously concerned, you're scared, you're anxious about your injury. Am I going to need surgery? Am I not going to need surgery? And if you can come in and talk about, I caught this 20-pound striper out in Casco Bay the other day, and we can lighten the mood a little bit, and then it takes the edge off. So we're going to have a full service line at Franklin Memorial. I'm excited to be there. If I can't take care of the problem, I'm going to get you in the right hands of people who can, because I was really impressed. I'll tell this story. When I was moving to Maine, I think I have a good pedigree in how I trained, and I thought, these guys, I'm going to go up there and they're going to look at me like I'm from the Ivy League, and I got up here, and the amazing providers we have in every specialty is incredible. Maine's becoming a destination for people who want to start their medical careers, and I think
good to hear.
that's great, and it's great for the people of Maine. I know a lot of people bypassed Franklin Memorial in the past, like, I'm just going to go to Portland. Well, no more. You don't have to do that.
I agree. I mean, one of the reasons when we moved over here from Bangor years ago is one of the reasons we chose this area was Franklin Memorial Hospital.
Yeah.
Because I wanted, knowing my own personal background, I've been known to visit there. I've been known to visit because I got scope bite hunting, where I had to have stitches. I have had some funny experiences where all of a sudden I couldn't talk and I couldn't figure out why, and nobody else could. Nobody ever still figured out why I lost the ability to think or talk. It was just like I was in a daze.
Yeah.
And they did all kinds of tests and came back, oh, you're normal. I said, yeah, really? Well, I'm glad I'm normal.
Yeah.
But just having them there, and then for other personal reasons, it's just a great place. And I'm glad that I think the energy and enthusiasm in Franklin Memorial has changed dramatically.
It's infectious
in the last
right now.
Couple of years.
The Maine Health merger has been, I wasn't here, it predates me, but I can tell there's a sense of enthusiasm there and an excitement that it's infectious.
Well, that, and I think Trampus is bringing something on where he wants to be part of the community.
That's right.
I think that's, as he and I've talked personally, I have some significant connections in this community.
Yeah.
Is a Franklin Memorial oftentimes was seen as aloof and all by themselves.
Yeah.
And now you're trying to come back out to be part of it. That's part of where our show is.
Yeah.
That's why we're trying to bring you guys on, so people get to know who you are.
Yeah.
And you can, when you have patients that's thinking about this, you can tell them, tune into my show and you see
I
who
will.
I am.
Yeah.
Just don't tell them you went to Kentucky. And Trampus is on our next show.
Oh, is that right? Good,
thanks.
good. All right.
I hope I don't see you again.
Yeah, I hope I don't see you again.
We'll
No
have
offense.
we'll have to get together for a beer sometime. We'll talk politics.
Amen.
All right,
Amen.
very
Yeah,
good.
good.
Thanks for coming.
Good.
Thanks for tuning in to Talkin' Maine with the Bow Tie Boy. Forgot my bow tie today. That's one of the few times in 400 shows. So we'll see you next week.